Thanks for joining the Musculoskeletal Disorders section. I am Justine Chim. The title of the paper is Occupational Disease Compensation, an update on the musculoskeletal health of office employees in Hong Kong. I would like to briefly introduce myself. I'm currently the student of doctorate program in design in the National Taipei University of Technology in Taiwan. I studied ergonomics in Australia and awarded the CPE in 2012. I'm running my own ergonomics and health and safety consultancy company based in Hong Kong. I have over 15 years experience in ergonomics and health and safety and served over 100 corporations in the past in more than 8 countries. In the previous research study in Hong Kong, it concluded that a very high percentage of office employees who spend prolonged hours in computing works. In terms of the musculoskeletal health condition of office employees, shoulders, neck, and lower back are top 3 body regions with musculoskeletal symptoms during 2011 to 2017. Among those reported with symptoms, about 40% of them they require medical treatment. The paper aims to introduce the Employee Compensation Ordinance in Hong Kong, in particular occupational disease in relation to the task nature and activities of the office employees with prolonged use of computers. The paper also reports an update on the musculoskeletal health condition of office employees in Hong Kong for the period from 2018 to 2019, as well as 2020 during the COVID-19 pandemic. Above the methodology, the legislation on Employee Compensation Ordinance in Hong Kong was reviewed with consideration of the associated area between the job nature of the office employees with the use of the computers and the potential outcome of work-related musculoskeletal injuries relevant to the occupational disease compensation. On the other hand, regarding musculoskeletal health statistics, a quantitative method using face-to-face structural questions was used in this study. The data were collected by an ergonomic consultancy company in Hong Kong during the ergonomic workstation assessment for the period of 2018 to 2019. The average working hours of computer use at work, self-reported body regions with musculoskeletal discomfort, and whether medical treatment had been received were asked. Regarding the condition during COVID-19 concerning work study from home, a survey was used for collecting the data during a postgraduate online lecture at a university in Hong Kong. In Hong Kong, there are 3 legislations which are relevant to the work health and safety and employee compensation on suffering from occupational disease for office employees. The ordinance in Hong Kong applies to all employees, no matter whether they are employed on a full-time or part-time basis under a contract of service. There are 2 types of liability for compensation under the ordinance: for the employee suffering incapacity from injury due to accident or occupational disease. Concerning musculoskeletal disorder of office employee in relation to computing work, the compensation for temporary incapacity could be relevant to the occupational disease cases under the Employee Compensation Ordinance. The Schedule 2 of the Employee Compensation Ordinance specifies compensable occupational diseases by law. Among all items in the list of compensable occupational diseases, only item 8 on the condition of traumatic inflammation of the tendon of the hands or forearm or of the associated tendon sheaths could be relevant to the task nature of the office employees with prolonged hours of computer work in which the tasks are frequent or repeated movement of the hands or wrists as per the description in Schedule 2. It is important to highlight that if an office employee suffers from musculoskeletal disorder such as neck, shoulders, or back pain, which the occupational diseases are not on the Schedule 2 of the ordinance, the employee compensation claims may not be accepted for compensations. In conclusions, the Office Ergonomics for the promotion of musculoskeletal health of office employees in Hong Kong becomes very important, and the musculoskeletal health statistic of office employees should be conducted on an ongoing basis. For the time spent on computing work, the result indicated that from 2018 to 2019, 96% of employees spent at least 6 hours a day on computing work. The percentage of prolonged hours spent on computing work during 2018 to 2019 was the same as for the periods of 2015 to 2017 at a high percentage. For the year of 2020 during the COVID-19 pandemic, the survey found that amongst the respondents, 58% of them have spent at least 4 hours a week working, studying at home with a computer or laptop. During the period of 2018 to 2019, 78% of the sample employees reported musculoskeletal symptoms. Among all reported discomfort cases in the past 10 years, shoulder, neck, and lower back were 3 high-risk reported body regions. For the year of 2020, during the COVID-19 pandemic, the results shown that 80% of respondents self-reported suffering from musculoskeletal discomfort. Among the reported cases, 15% had discomfort in more than one body region. For those who had one body region discomfort, neck, lower back, and shoulders are 3 commonly reported body regions with discomfort. To sum up, the continuous high percentage of self-reported musculoskeletal discomfort was looked at. For the result of medical treatment, the results show that the percentage of self-reported musculoskeletal symptoms was similar to previous years. However, only 8% of sample employees reported musculoskeletal symptoms and required medical treatment, which was significantly lower compared to previous years of 39% to 52%. We speculated that this was caused by the Hong Kong protests, which affect business operation and day-to-day personal life in 2019 to 2020. For the year 2020, among 80% of the respondents who reported musculoskeletal discomfort, 77.5% of them didn't visit a doctor or therapist in the past 6 months. During the COVID-19 pandemic, people who may have suffered from medical condition had less intention to visit a doctor or therapist for consultation for following the social distancing advices. In regard to the computer workstation and equipment used for work and study from home during COVID-19 pandemic, 34% of the respondents used laptop, tablet, or phone from work study from home. It is not a satisfactory computer workstation setup for long computer use. On the other hand, 28% of the respondents had a fully equipped workstation setup for using a laptop or desktop connected to a separate monitors, keyboard, and computer mouse. This is a more ideal setup with a separate monitors and input devices, so the computer user can possibly maintain a good working posture. For the perceived suitability of work and study space at home during COVID-19 pandemic, only 54% believed that their work or study space at home was unsuitable, and only 10% of them were unsatisfied with their workstation setup at home. However, very high percentage of survey participants who self-reported musculoskeletal discomfort and didn't have a full workstation setup as well. It shown that the survey participants had no awareness on healthy computing concept for work and study from home. In conclusion, the company should promote office ergonomic practice for working from home so they can acquire the knowledge and skill for a proper workstation setup and adopt a healthy posture. This paper concluded that musculoskeletal health has been an area of considerable concern in regard to the office employee well-being in Hong Kong. Office employees spend long hours with computers, especially in the new norms of work from home. The potential for musculoskeletal health issue will be more significant as the computer workstation may not be properly equipped and set up in the home environment. The selection of appropriate furnitures and workstation setup are required for the prevention of musculoskeletal discomfort. Thank you very much. I hope you enjoy my presentation.